Hi guys, it is Dee. I am making a video tonight to talk to you about something medical. I have had a few questions from people and contacts and people I know about this, so I thought I'd make a video about it. So maybe that would be helpful. Okay, so it's regarding the COVID-19 virus, but it's not. It's regarding a virus, not even a virus, a group of symptoms, and they're very they're varied symptoms that people are experiencing weeks to months after they've experienced the initial COVID-19 infection. So usually it can be any period after the infection, but usually it's between 4 and 8 weeks. The symptoms are nothing like COVID-19. They are not COVID symptoms at all. I'll get into what the symptoms are and what you'll experience, and a whole bunch of you might be like, oh my God, I had that. So I know I certainly did have this. So, but it didn't last very long. And I feel well, so I feel like I'm pretty lucky because this can last a very long time. So this is a condition that healthcare providers are referring to as the COVID condition, or long COVID sometimes, or COVID-19 syndrome. And it can be experienced by both children and adults. It's not discriminatory. You're more likely to experience this condition following the COVID-19 virus if you were hospitalized or in intensive care during your COVID virus because it was so severe. You're less likely to experience this if you were vaccinated and if you had at least 2 vaccines. That does bring your expectancy of having this virus, or not virus, these symptoms down. It really reduces your risk. However, I was fully vaccinated and I did experience these symptoms, so particularly the physical ones. So I'll start by telling you right away, there's no cure for it. It is symptom management, but we'll get into that as well. So first off, it's about 10 to 30% of people that have had the COVID virus that will experience this post-COVID virus, this post-COVID's condition or syndrome. I have some notes here because these symptoms are all over the place. Okay, so first there's the mental health symptoms. People will experience extreme anxiety, depression, and even PTSD symptoms. So that will happen, and it comes out of the blue, and they may be people who are prone to experiencing mental health issues like depression or anxiety, or do have existing PTSD, but it can also be experienced by people who have never experienced these problems before as well. So it's a brand new thing, and they're just shocked because they don't know where this is coming from. Now, physiologically, your physical symptoms, I'm going to read these because there's a lot of them. There's lethargy and fatigue. Lethargy is when it's like a brain fog feeling. It's like when you're just exhausted and you just don't feel sharp and alert. You feel like you're thick and you're heavy and tired. Somewhat how you'd feel if someone just woke you in the middle of the night and your head isn't clear yet. And exhaustion, fatigue, the cognitive impairment, again, is sort of like a brain fog kind of symptom, but this can last throughout the day and night and not go away. It can be persistent. Feelings of breathlessness and chest pain, that can be one of those conditions, one of those symptoms. Headaches, sleep difficulties and sleep disturbances, insomnia, inability to exercise because your body is just too physically exhausted. You're just intolerant of exercise. And MSK, or musculoskeletal and joint pain. And that's when I had it, that's what I experienced the most. I had severe joint pain. I was terrified. I thought something was wrong with me until I started really diving in and doing some research into this. So it was quite severe. My ankles, all my joints, they were severely hurting all the time when I moved. So I do want to mention something though. I did mention breathlessness and chest pain. Although this is one of the symptoms experienced, I do want to clarify that if at any point in anybody's life you're experiencing shortness of breath or breathlessness and chest pain, I do not care if you've been diagnosed with post-COVID virus condition, anything. I don't care what you think you have or don't, or what a doctor's told you, even if a doctor's told you have it. If you have shortness of breath or breathlessness and chest pain, you call 911. and have an ambulance come and let them assess you and check your heart on their ECG machine and see if your heart is okay. Because of course those are predominant symptoms of a cardiac arrest as well. So although those can be a part of having this post-COVID symptom group, but it can also, it's more likely to be your heart than that, because less people experience post-COVID syndrome than those experience heart problems. So if you did experience that symptom, please call 911, and if they rule you clear, then you can talk to the doctor about it and let them know you're having that experience, and they can deal with it. But that's a 911 immediately. That's not a wait and see the doctor. Okay, so I just wanted to be clear with that. Other than that, there's not much to talk about here. I really wanted to just get across and let you guys know, if you're feeling rough and feeling symptomatic and having some of these feelings, it is most likely a COVID-related virus or a symptom group that you're experiencing, and it is as a result of the COVID virus. It can last very long, and sometimes that's why it's referred to as long COVID. It can last very, very long, many, many months, and there's no prognosis as to when it's going to stop, or it can be quick and short and you can get over it. The trick to this one is all in symptom management. So what you need to do if you think you're feeling some of these things is talk to your doctor, particularly if you're feeling any symptoms that are causing you to limit your normal daily activities, and any mental health symptoms at all, anxiety, depression, PTSD, anything like that. You need to visit your doctor right away. You need to talk to your doctor about the symptoms you're experiencing, and they'll be able to give you medications or give you advice on how to treat each individual symptom to the best way they can, and help you get through this so you're the most comfortable as you can be, and so that you can continue with your day-to-day activities and not be limited by it. There was one thing I had highlighted here, and I wanted to mention it. So if you are experiencing severe mental health issues and you're not suicidal, you're not feeling like hurting yourself or hurting anybody else, but you are suffering right now with mental health issues, you can visit a website, and they have a huge range of resources and supports. And this website was new to me, but I checked it out and it's fantastic. It's called Wellness Together Canada. So write that down. You can use it for anything, not just this, but any mental health issues. They provide they just provide resources and supports to anyone in need. So again, it's Wellness Together Canada, and you can use that, look up that website with at any time for any mental health issues. If you need advice, you need to know where to go or what you can do, what your options are, tips on how to handle certain things. That's a good place to go to find out where you can find these resources. So other than that, there's not much to talk about here. Just know that if you did have COVID a few weeks ago and you're starting to have all these other strange symptoms that aren't COVID related, they seem just to be like so variable and different and odd, like headaches and body pain and exhaustion and fatigue and all these strange things, there's a chance it could be this post-COVID syndrome. So I would visit your doctor. Of course, always visit your doctor if you have anything going on and get that confirmed, because the doctor can confirm that for you, and get some symptom management so it's not interfering with your daily life. You need to be able to continue with your normal activities and exercise and eating and sleeping well. The insomnia is a big one. I experienced that with it, and it was tremendously limiting. It was I was so tired and I couldn't sleep. So that was a big one for me, and it just came out of nowhere. So if you're feeling any of these things, definitely see your doctor and get some help with that. And yeah, there is symptom management for it. That's the best part. There isn't a cure, unfortunately, but the symptoms can be managed successfully. So that's all I wanted to talk to you about. And again, if you are experiencing any shortness of breath and chest pain, don't assume it's a COVID syndrome. Please just call 911, and then if they give you a clean bill and say your heart is fine, then maybe you can talk to your doctor about it as a COVID related symptom. But that's a 911 call first and foremost. So that's all for tonight, guys. It's a quick one. I just wanted to bring this up because I have had a few people ask me, everyone knows a nurse, and people, whenever they have questions, they call the nurse they know and ask. And I've had about 3 phone calls from friends and family that have asked me if this is a thing, and so I really looked into it good and hard, and discovered that it is a thing in fact, and it's a lot more common than I thought it was. I had known about it, but I thought it was very rare. Turns out it isn't very rare at all. It's quite common, and it does affect children and adults equally. So if you got a little one that's having a hard time getting up and down the stairs after they had COVID and stuff like that, of course you need to see the doctor with the child right away. But you could find out that that's what this is and that's what's going on. So that's all. I hope everyone has a lovely evening, and I will probably make a video, maybe something fun tomorrow, and I'll see everybody soon. Take care. Bye.